తెలుగు వారందరికీ నమస్కారం. తెలుగు మంత్రి సమితి మెంబర్లందరికీ మేము ప్రామిస్ చేసినట్టుగా ఈ రోజున మొట్టమొదటిసారిగా ఈ ఎడ్యుకేషనల్ సెమినార్ సిరీస్‌లో డాక్టర్ షేఫర్ గారిని పరిచయం చేయడం జరుగుతుంది. ఆయన ఒక శాస్త్రవేత్తగా కానీ కాకుండా ఒక సామాజిక సోషల్ రిఫార్మర్‌గా ఆయన చాలా he's an inspirational guy. He achieved ton of highest credits in science, and he's a research scientist, and he's a social activist. He has a great inspirational story to tell us and inspire our Telugu community, and his personal story, how he grew up leaps and bounds from normal life to become a scientist and contributing to St. Jude. And also he made a change in Memphis social life, and he brought skating arenas in Memphis, and he's engaging young people into active skating role. Dr. Shafer's story is very inspiring, and you'll learn a lot of stuff from this. We are going to, as we promised, we are going to add more and more inspirational speakers. The very first, we're very lucky to have Dr. Shafer, and he's going to share his personal story. With that, we will go from here, and we're going to engage and bring more community leaders and corporate leaders, as we promised, and the leaders who made the change in the society. Those are the people who are going to bring it to our community, our youngsters. With this small effort, what we are bringing to you guys, at least a few people, if we can inspire, our program will be successful. And we are with the auspicious cause, with the humble intent, and with the genuinely we wanted to help the community. This inspirational speech is going to be really impressive. I guarantee you will enjoy this 1 hour of conversation. With that, I'm going to welcome Dr. Shafer and our directors for the education program, Dr. Murali Redwari and Dr. Shrikar Velichetti. These two inspiring leaders are going to take it over from here. Thank you.
Thank you, Srini Garu. This is Dr. Muralidhar, and I have with me Dr. Aaron Shafer and Dr. Shrikar. Aaron has started working in St. Jude in 2006, and he has been a friend of mine for the last 15 years or so. He works as a senior scientist at the CGMP facility. We are involved in manufacturing of vaccines, biological products for clinical applications. Dr. Aaron also has been a community leader involved in development of skating parks, often fighting with the city of Memphis to get for getting funding. And it gives me great pleasure to introduce Dr. Shafer, and his experience would be a valuable advice to all of us. Dr. Shafer, please take over. Thank you.
Hello, I'm Shrikar Velichetti. I am one of the other education directors with Dr. Muralidhar Redwari. As you can see, I have Dr. Aaron Shafer with me right here. And today he is going to inspire all of us with his excellent journey. And I'm going to moderate this session. So Dr. Shafer, you can take over right now.
Thank you, guys. A lovely introduction. We're just getting the slides put together, and once we do that, we'll get going here. Okay. So today, basically what we're going to talk about is where Mural and I work. And so I'm going to give you a little virtual tour of the Children's GMP that we have on the campus of St. Jude Children's Research Hospital. Also, we're going to, that tour is going to consist of teaching you a little bit about what the GMP is, as well as the products that we manufacture there. And then we'll also look at the staffing structure, so you get an idea of what sort of positions are inside this facility. From there, I'm going to talk to you all about biotech careers, as well as some future careers in areas that I see growing within the biotech field that would be interesting, I believe, to pursue. These would be areas that I would think about if I was in the position of some of your children who are about ready to go into grad school, to think about going into these areas. And then from there, we'll transition into talking about my efforts to get skateboarding parks introduced and established in the area of the city of Memphis, as well as the metro area at large. So that's kind of an outline of what we're going to go through today. And with that, let's take a look inside the Children's GMP. So here in this slide is pictured the GMP, which is on the northwest corner of the St. Jude Children's Research Campus. The GMP actually opened its doors in 2003, and it actually was the first GMP that was built and established on a children's hospital research campus. So that was a big deal back in the day, back in 2003. So the GMP itself, the acronym stands for Good Manufacturing Practices. And the big idea behind our facility was that the GMP would be able to complete the bench to bedside cycle. So that cycle is shown here at the bottom of the slide, where in clinical research, potential therapeutic drugs are developed. And then that potential therapeutic drug would then be taken across the street to us, and we would try to scale up that drug and then bring it all the way back across the street to the clinical side where it would undergo clinical trials. So you can see it's a cycle that starts at St. Jude and finishes at St. Jude, thanks to the GMP being that intermediate part. So one of the big rationales for having a GMP is the fact that our patient populations are quite small. And when you have a small target patient population, often drugs are orphaned or not manufactured. So we call these orphan drugs because major manufacturers are not interested in, at the scale that we're making, they're not interested in doing that because there's no real market for them. So having our own GMP allows us to manufacture at a much smaller scale, and then allows us to be able to treat those small patient populations at St. Jude. So our building itself is named after one of the code of the federal regulations that we have to follow. And in fact, the name of that code of federal regulations is CFR 21. And so the FDA falls under CFR 21, and we ourselves are subject to being audited and must be compliant to the FDA regulations, which you find in the CFR 21 guidelines. If you go to ecfr.gov, you can look at all the different CFRs that are on basically the federal regulations that govern so many different areas within the US itself. So CFR 21, I believe, is one of, 60. So within each CFR, there are hundreds of regulations. In fact, CFR 21 has 1,300 regulations, and each of one of those could be several pages. So it's a lot of paperwork to keep track of, especially for our GMP facility. And so our quality assurance group is the group that ensures that we are remaining compliant in our operations in terms of manufacturing and our day-to-day operations. Okay, so that's just a brief overview of the GMP, why it was established and what we are. And now I'd like to actually go through with you all and talk about some of the products that we manufacture. So one of the products that we make at the GMP are avian influenza seed stocks. So basically each year or every couple of years, there's an outbreak of avian influenza, typically over in Asia. And when that happens, one of our labs, research labs, the Dr. Richard Webby's lab, will go over there and actually take samples and they'll come back and isolate all the genes and put those genes into another vehicle known as plasmids. Those plasmids will receive those plasmids and will actually reconstitute or recreate those viruses so that we can make seed stocks. And one of the major reasons why we make seed stocks for avian influenzas is because of the potential for those viruses to cross over to humans. Now, that sort of event is actually quite rare, and the reason for that is the avian viruses typically have a tropism, or they tend to migrate according to the receptors that you find in the epithelial cells of animals. And so the avian virus goes after alpha-2,3 sialic acid receptors, which in humans you find it in the lower respiratory tract. In chickens, you find that same receptor in the epithelial cells in the upper respiratory tract. So essentially, poultry are able to get infected quite readily because it's one of the first points of entry where they are able to infect those epithelial cells. Whereas by the time that same virus reaches down to the lower respiratory tract in humans, the chances of that virus making it that far is very, very rare, in that it would normally be taken up by epithelial cells that are in the upper respiratory tract and cleared out of the system. So the main issue being is there is precedence where an avian virus can mutate and it changes tropism so that the specificity of that virus can change and actually start to bind to receptors in the upper respiratory tract of humans. And that's actually what happened with the 1918 flu. There was the virus that was responsible for that massive pandemic back in 1918 was thought to originally come from poultry. And what happened is there were a couple of mutations that were sequenced in the HA gene of that virus, and just those two mutations allowed for that virus to cross over and become and allow it to cause human-to-human transmission of the virus. So it is a big deal, and so basically St. Jude acts as a surveillance site for avian influenza to ensure that if that ever happens, that we would have seed stocks which we could scale up and manufacture to make vaccines against these mutated viruses. Okay. So the second product that we manufacture, which I was involved with back in 2016, is RSVF, the RSVF virus, which is basically the respiratory syncytial virus, which annually affects around 120,000 infants, mainly in the US, and around 900,000 globally. So it's a serious condition, especially among babies. And so we make this vaccine, and recently in 2020, a safety study was completed in adults that showed that this vaccine is quite safe in adults. The next step for this virus would then be to immunize children. So, but before doing that, we wanted to make sure that the adult population would respond to it without any major side effects, and that was the case for this study. The next product that we manufacture, which Murali actually was quite involved with, was the manufacturing of a monoclonal antibody called HE1418 K322A. And this antibody is directed against neuroblastoma, which is basically a cancer of immature nerve cells. So the way this drug works, which is shown here in this picture, is the antibody binds to the neuroblastoma or the cancerous cell and coats the entire surface. Here I just have two antibodies shown in these kind of orange scissor configurations. And by coating the cell, essentially the cell becomes flagged by natural killer cells of the immune system. And so the natural killer cells will see the flags or the antibodies and kill the cancer cells. So another phase 2 clinical trial was completed using this antibody in combination with chemotherapy. And these were done with children who had relapsed with the cancer. So the survival, 2-year event-free survival rate increased from 60% to 85%. So that's a marked increase in the survival rates for these kids who were had already had previous episodes and had relapsed into the cancer state again, shown here. The next product that we manufacture is a gene therapy product. And what we're essentially doing here is we're taking a virus and using it as a gene shuttle. So we're able to use the adeno-associated virus. And within that virus, we put a gene in called factor 9. And so the name of the product is shown here as being SCAAV2 factor 9. So what factor 9 is a clotting factor that typically when you cut yourself or get a wound, your blood will clot, and factor 9 is involved in that clotting cascade. Humans with hemophilia B have a mutated version of factor 9, and so what we've been able to do is introduce this AAV shuttle or gene product with the factor 9 gene into these patients, and we're able to restore factor 9 levels from 1 to 5%. And that doesn't seem like much of an increase, but because factor 9 is an enzyme and is catalytic in nature, that's sufficient to restore full function of the clotting cascade in hemophilia B patients. And just to take you back, I'm going to date myself here, 30 years ago in high school, we used to talk about gene therapy. There was more of a dream and not much reality to that. And now here we are in 2021. And in this case, 2017, actually performing gene therapy. And this was a landmark study in the gene therapy field when this came out in 2017. Another product that we manufacture, actually our cell therapy manufacturing team, is Lenti-X-Skid. X-Skid stands for X-linked severe combined immunodeficiency. And similar to AAV, we're using Lenti virus, which as also a shuttle protein for delivering another type of gene, which is the gamma chain gene. And the gamma chain gene is needed and required in order to assemble interleukin receptors within immune cells and when you get this assembly of the receptors in these immune cells, you're able to basically develop a healthy immune system. So children who suffer from X-Skid, also known as bubble boys, the bubble boy syndrome, do not have immune system. However, when we deliver this X-Skid gene therapy product to them, just recently, actually last year, 11 patients were shown to have their immune system fully restored. So it's 11 babies, I should say. They were infants. So again, another landmark study that occurred here at St. Jude. It's quite exciting to think that we were part of that at the GMP. All right, so the last product we're going to talk about is CRISPR-Cas9, and I'm sure many of you have heard of CRISPR-Cas9 in the news recently. In 2020, the lady behind the discovery that Cas9 could serve as a gene editing enzyme received the Nobel Prize in chemistry. So what we're trying to do is treat patients that have sickle cell disease or beta thalassemia, which are both blood disorders. And so with sickle cell disease and thalassemia, what happens is the genes responsible for making the beta globin chains shown here in this picture there's either a mutation in the case of sickle cell anemia, which I'll show to you in a second, or there is a mutation upstream of the gene, which does not allow for sufficient expression of those chains in patients with beta thalassemia. So shown here is Elaine Twalman, who is one of our members in the infectious diseases department, and Emmanuel Carpentier, who's on the right-hand side, is the one who received the Nobel Prize last year. So she was a former postdoc in Elaine's lab. So in a sense, St. Jude has its second Nobel Peace Prize. And even though she did not do the work at St. Jude, she worked at St. Jude for a number of years. So CRISPR itself stands for Clustered Regularly Interspaced Short Palindromic Repeats. You can appreciate why we call it CRISPR. You could spend all day long trying to say that. So all that means is bacteria, back in the early 90s, it was shown in bacteria that they had what was considered junk DNA or baggage. And it was all this DNA that they were storing. And at the time, it was not appreciated for why they even had that. It was considered just to be, useless and not functional. But what was eventually shown was that this junk DNA were actually DNA sequences of bacteriophages. And what bacteriophages are viruses that will go in and attack and kill bacteria. So what bacteria would do is when those phages would infect them, they would start storing the DNA from these phages. And so that baggage DNA is basically served as an immune surveillance system for the bacteria. So Cas9 would take up a piece of that DNA and then match it against a phage. And if there was a match, then Cas9 would go ahead and chew up that phage DNA, and the phage would be destroyed. So quite an elaborate little scheme that bacteria have for warding off their own virus infections. So in terms of numbers, sickle cell disease affects around 300,000 people annually, beta thalassemia around 60,000. And with both of these diseases, you see early death. There's a substantial amount of pain, especially in sickle cell patients, because of the shape of the red blood cells, and they require ongoing transfusions to combat anemia. So it's a pretty serious disorder to have. So essentially what happens in sickle cell anemia is you have a mutation in the protein where a normal glutamic acid, shown as GLU, is mutated to a valine. And when you have this mutation, this significantly changes the structure of the beta chain or the beta globin chain, such that the hemoglobin structure starts to aggregate together, and you get this half moon or sickle shell shaped. And so when hemoglobin aggregates, it causes this structure, and which then bends the red blood cell into the half moon or sickle cell shape. So this here, what I'm showing is the title of a paper that came out recently, actually January 2021 this year, from a massive collaboration that was done at St. Jude. And they were able to demonstrate that they could cure both sickle cell disease and beta thalassemia using this Cas9 protein, the CRISPR-Cas9 gene editing program. So that was a collaboration between St. Jude, Vertex Pharmaceuticals, and CRISPR Therapeutics. And as you can see, there are a lot of people involved in making this happen. So this is kind of a busy slide, so just bear with me. I'm going to basically try to walk you through what happens, basically how this treatment goes. So on panel A, what you're looking at is the normal progression of fetal hemoglobin being transitioned, basically the transition from fetal hemoglobin to adult hemoglobin. So right before we're born, your gamma globin chains synthesis or expression of that gene starts to decrease under the control of a transcription factor known as BC11A. So gamma globin goes down and your beta globin goes up. And you start, in a normal person, adult hemoglobin becomes the predominant form of hemoglobin. So the problem is, if you have sickle cell disease or beta thalassemia, is when you start to try to ramp up the mutated version of the beta chain, you start to see the onset of the disease. So the idea behind trying to cure this is would there be a way to basically prevent gamma globin chains in fetal hemoglobin from not being turned off? So that's where CRISPR-Cas9 basically comes into play. So if we can turn off the expression of the transcription factor, which turns off the expression of gamma globulin, or gamma globin, then we can increase the fetal hemoglobin. And so if we restore fetal hemoglobin levels in these patients, they would have a normal outcome. And that's exactly what they did. So shown in panel B is Cas9, the protein, and then the sequence of DNA. And by having that sequence of DNA bound to Cas9, it's able to go in and bind to the BC11A promoter region of the gene and essentially turn off expression of BC11. So if BC11A is turned off, it can no longer regulate the expression of the gamma globin. And so gamma globin expression goes back up, and you get fully functional fetal hemoglobin in these patients. And that's exactly what the study showed. It showed within a year's period of time that the fetal hemoglobin had replaced the human hemoglobin levels, and the patients were no longer symptoms of the two diseases. So this is a pilot study, and we are currently making Cas9. As I said, Murali actually has been a lead scientist in the manufacturing of Cas9, so he just finished working on developing the upstream and downstream processes that will be required to make this protein. So that's a big deal for our hospital. Again, this publication went out in 2021 in the New England Journal of Medicine. So another landmark study for St. Jude. It's easy to forget when you're working at our GMP, really how significant the products that we make here. But these are major breakthroughs in the area of science and gene therapy. So I'm really happy to be able to share this with you guys. So a little bit about how our GMP organization works. We have essentially 5 teams at our facility: quality assurance, manufacturing, process development. Process development is where Murali lives. Quality control and analytical methods development. I'm on the analytical methods development team. So I'm going to briefly go over what each group does, and then we'll go look into some of the careers options and how to get into those after that. So quality assurance is essentially a lot of documents. They do documents. They make sure all of our batch records, all of our SOPs, all the paperwork that we do are compliant and complete. And so on the left are 2 of our workers, Stephanie and Tamara, going probably likely over some sort of log from a room or a batch record. And then Ronnie is in our records room, where we have all our different documents that we need that are stored. And we are currently in the process of transitioning to an electronic format. But that doesn't mean any of these records, physical records, will go away. It just gives us easier access to them. So then there's my group here. This is Jan, my coworker. So our team has 3 people: my director, Jan, who mainly works on the mass spectrometry, and myself, who my focus is on UPLC and CE, and I'll explain those to you guys in a minute. But what we're mostly in charge of doing is developing analytical tests that will test the purity, identity, and sometimes the concentration of the drugs that we make. So here is a chromatogram that has come from doing HPLC, also known as high performance liquid chromatography. And so this is a purity assay. So this was a sample that Murali gave to me. And what you're seeing, that large peak there, is the main product, and that's Cas9. And on the side, there's some very small peaks, which are impurities. So if we blow those up, you can see that there's a couple of impurities. However, overall, this product is 97% pure. If you go by the total, the percent peak area is 97% for that large peak. So that's an excellent purity. Anything above 95% is excellent, considered excellent in, for a release assay for purity. And there is Dr. Murali Reddivar in person, doing his magic on the bioreactors. He is Not sure what he's doing actually. He's probably opening up some tubing and is about to feed some cells. Those containers above that red colored media is cell culture media, and that's the media that actually feeds the cells. Jason is operating an Acta skid, which is a purification skid for purifying. Most likely he's purifying HU1418 antibody. So that's process development. And basically what process development is going to do is, as the name implies, develop a process that will go on and be used in manufacturing. Speaking of which, here's our manufacturing team. You can see they look very different. They are gowns. So we all wear scrubs in the clean rooms, but they wear sterile gowns on top of their scrubs and head coverings as well as masks. And yes, they wore masks before the pandemic as well. And those are required during manufacturing. So they're basically going to be doing the same work that Murali did, except for in a very clean environment that's been released for manufacturing of the drug. Here's our product fill suite. This is our product fill machine made by Chase Logeman, and we're able to vial our product using this machine. I think this Chase Logeman machine vials up to 1,000 vials an hour, which is fast for us. We used to do it manually with a pump, but we upgraded about 4 years ago to this unit. Then we have quality control. Quality control does almost all the testing, both for products and also for monitoring the air quality in our rooms to make sure our clean rooms are actually clean and provide a sterile environment for our products. And so what I wanted to basically show you is this data shows you how few particles we have in our clean rooms. And so what you're seeing here we have 7 particle counters that are counting particles. They're basically sampling 1,000 liters of air per particle counter. And you can see on average, you've got 1.77 particles per 1,000 liters for particles greater than 0.5 and particles greater than 5 microns. You don't even have 1 on average. So, I mean, there's basically, it's like being in space almost, except for it's particles, not gas. So our class limits are 3,500, so we're well below the limits for class B. And just to compare, in a typical office space, if you do the same calculation, you have about 26 million particles that you have in your office space. And that, if you calculate what that corresponds to in one breath, you're breathing in around 120,000 particles per breath in an office space, compared to pretty much 0 for our clean room. So we're really clean, which is important, when you want to keep your product sterile. Other tests that quality control does on a routine is the pHing of solutions, which is important for buffers. They also do sterility tests. Thankfully, this Petri dish is not coming from one of our products. So this is just a representative Petri dish, but they'll take Petri dishes and push them on walls. They'll put product on there and just make sure nothing's growing. So unlike this dish. They also test for endotoxins, which are residual molecules of bacteria. One of the most common ones is lipopolysaccharide, which I'm showing here. Lipopolysaccharides are essentially components of the bacterial cell wall that often get shed when you're purifying products. They're everywhere. So they do, if you don't control for those components, of bacterial components, people can have severe immune reactions when they're treated or infused with drug products. They also do purity testing as well as our group. Quality control also looks for purity of products. And so I believe this is a SDS page gel of Cas9. This is Murali's. So they'll look at purity of the Cas9 product using gel electrophoresis. And so putting it all together, this is how all our different groups work. If you were to look at a timeline of how long it takes for, let's say, to make one of our products, it could be, anywhere from, just it can take 5 to 15 years for R&D, and then usually it could be up to 3 years, 3.5 years from start to finish once a product comes across the street and we start working on it. So I'm not going to go through each of our groups, but you can see there's significant overlap and where we're all working together at certain times. But yeah, that's our staff. That's our structure that we have. And in terms of careers, if you're thinking about a career in biotech, what do you need to do? What's important? Let's start with quality assurance. What do you look for in a college? You want to look for a college that has partnerships with the industry. That's pretty standard for most degrees. Do they have a QA program, or are they associated with GMPs? That's something you want to look for. I talked to 3 of our quality assurance employees. I emailed them asking them, what do you guys think is important for some of these young students to do to get into this field? And there was a consensus among them to basically just get your foot in the door, get an entry-level job in a lab. And most of them actually started in a lab, and then they migrated out of the lab and started slowly getting exposed to basically quality assurance jobs. From there, they also suggested getting regulatory affairs certifications. You can join a society. These are probably things you want to do once you are in a QA position itself. It wouldn't make sense to do that if you're still working in the lab. You can also go the master's route. There are many colleges that offer a master's in quality assurance, such as Temple University School of Pharmacy. The only drawback to these masters of science are they're very pricey. So you may want to first get into a company that maybe perhaps will pay for that master's for you, rather than you going that direction. I would, again, it just depends on what your budget is, but if you're on a tight budget, I would consider getting your foot in the door first in a lab and then working your way towards that position. So here's just I found this quality assurance specialist. This would be like an entry-level position on a jobs website for Millie Tinnell Biotech Incorporated in San Jose. So another great way to start preparing yourself for a QA position is looking at job descriptions. And I think that goes for a lot of different positions. Like, well, what are the keywords? What are the key, what's the key experiences that you need to have? What are the skills and tools that are on that job description? Then you can start piecing together how you need to get those skills and tools. So let's then go on to quality control and my lab. It's similar suggestions for the quality control as well. Look for those internships, look for an entry-level job in the lab. If you've got your PhD in biology or biochemistry and molecular biology, you are already very well qualified for a quality control position. A lot of the skill sets and a lot of the tools that you learn for finishing your PhD will be directly applicable to QC or quality control. It's just a matter of, write your resume so it shines, so that it really magnifies those tools that you already have and makes you look like you're a great fit, because you are. So manufacturing, you can actually go into the engineering field from more manufacturing, get your bachelor's in biochemical engineering. Christian Brothers University here in Memphis has that route. So, look at the colleges. This is more of a mature field. There are lots of colleges where you can get a bachelor's in either chemical engineering or biochemical engineering, and that will tailor right into manufacturing for within a biotech or GMP facility. An interesting route that I would have thought about, that I would have considered 20 years ago, would be a bachelor's in fermentation sciences. If you have a bachelor's in fermentation sciences, you're very attractive to a lot of microbreweries, which are popping up all over the United States. That's an aggressively growing field. So, for example, Colorado State University didn't have that program, and partnership with Fat Tire Brewing Company, they created that program so that they could start, educating their own college students and feed them right back directly into that company. So that's definitely a growing area in biotech, or the fermentation sciences. At my alma mater, where I got my bachelor's and Ph.D. from UC Davis, has you can get your bachelor's, master's in science, and a Ph.D. in brewing. They have a 50,000 square foot brewing facility, and they also have a very large viticultural program there. The Mondavi family donated, I believe, $50 million, so you can do brewing, or you can do viticulture. It's a strong field to consider. And then again, for manufacturing, look for entry-level positions too. That's another option. All right, so PhD in biological science is also very relevant for a manufacturing position. Just like I mentioned with quality control, look to see how much of your skills overlap. If there's a match, you can apply right out of graduate school. There's no need, if you're going into biotech for manufacturing, to go have a postdoc. And right now, the job market is so strong that you definitely don't need to do a postdoc. You can go right from grad school. And that's been a major change in the last 10 years. 10 years ago, it was very difficult to find a job in biotech. You can go right out from your PhD. So there's lots of options now with a PhD. Okay, so looking into the future, where do I see growth in biotech? I think a large area of growth in the future will be if you get your doctorate in biodegradable polymers research. I mean, we all know, we're all very aware of how much trash we create and how much plastic waste there is in the environment. Well, this is an area where I think, it's worth exploring. If you, at Queen's Mary University of London, you can get your PhD in biodegradable polymers research. And then at Harvard University, there's the WIS Institute, and there's a group over there that is working on basically taking CO2 emissions and converting those emissions along with hydrogen gas into biodegradable plastics. So, there's a couple PhD members over there working on that. So look into that. And then New Light Technologies is a company out in Huntington Beach, California. They're already making utensils and all different types of plastic products out of these plastics that are being made within bacteria. So look for that future growth. And in terms of just like St. Jude, where we really draw a really strong sense of purpose, I believe being in this field, you also really satisfy or get a real sense of satisfaction knowing that you are eliminating plastics from the world. So this is a little diagram of how that works. So on the left, you see the little traditional factory putting out CO2, and then that CO2 goes into a fermenter. So someone with a fermentation background would also be able to do this type of job. So you're fermenting bacteria. The bacteria take the hydrogen and the CO2 and convert it into these biodegradable plastics. So I mentioned New Light Technologies already. Another area of growth is tissue engineering or tissue regeneration. We wear out as humans, and we have a lot of people that are active, including myself, where parts wear out. So currently, as of 2021, we don't really have a good way of replacing tendons. So I like this quote from Dr. Nelly Adras-Puri. She works on tissue regeneration and tendon research. She says, once a tendon is injured, it almost never fully recovers. You're more likely to prone to injury forever. So, in terms of orthopedics, we're doing pretty well with ligaments and replacing, hardware in our body, but not so great with the soft tissues, which is what a tendon is. And anywhere where you have a job where you have repetitive motion, you're going to have tendons that wear out. So anyone that works on a computer, which most of us do, you name it, moving boxes, sports, it's going to be another area. I believe it's not going anywhere too soon. And so I see growth in that area of research as well. Okay. So that's the science of the science skate talk. And now we're going to talk about skateboarding. Just change gears really quickly there. So this is more of the social activity side of my career and what I do when I'm not in a lab or working at the GMP. So if you want to know ad nauseum in detail what it took to build Memphis's first public skate park, you can watch the Finding Toby documentary, which I believe Morale sent to you all as a link. That will detail exactly who was involved, how long it took, all the different people that I had to work with in government to get it done. It's a great film that my friend Chase made. It's worth watching if you like skateboarding. It is long, it's an hour, but again, I'm not going to go through all the details here. Suffice to say is in 2006, when our family moved here, it was disturbed that there was not a skate park. I moved here from California and had just gotten into skateboarding when I was at my postdoc at Stanford. So we moved here and that activity rapidly ceased. So in 2006, I set up a website called Skate Life Memphis and started talking to people in the government. And basically 4 or 5 years later, we opened up the first public concrete skate park for Memphis over near the fairgrounds. And so what was the lessons? One of the major lessons I learned is numbers matter. We had almost 300 people show up to a rally that the city hosted. They were expecting maybe 20 to 50 people to show up, and we flooded the area with skateboarders. So it was quite the experience. But from that, the parks director went to city council and requested $500,000 in CIP funding to build this park. So that happened in 2008. We got funding, and then that money sat for almost 3.5 years. And so the other lesson I learned was to be patient and be persistent and professional. So lots of emails to people in government reminding them that they need to get this project done, and otherwise we're going to lose the money. So I learned a lot of things, learned how to work with people and how to be polite. And yeah, that's the other P. So yeah, so Toby Park opened up in 2011. We hosted skateboarding competitions there from 2012 to 2016. I retired from doing that since then. It was a lot of work. In 2015, I started trying to get surfing into Memphis. I thought, with how hot our summers are and the fact that we don't have any water parks and that most municipal pools are overcrowded, that we needed a place to cool off. So I worked on that with the city of Memphis from 2015 till just recently last year. I kind of put that on the back burner. Hopefully it resurfaces, we'll see. So there's a nice picture of what one of these wave pools look like. And these wave pools don't look like anything that you would see at a water park. They actually look like real waves, so they're quite impressive. And that technology has just come out in the last 5 to 10 years. So it's pretty cutting edge. So then I'll talk about the ripple effect of Toby. It's amazing what's happened since that park was built. And my friend Ed Pigeon, shown here on the right-hand side, he has since passed away a couple of years ago. But he worked at the farmer's market for 4 years in a row and basically solicited donations at the farmer's market. In their case, they had the land by the city. It was donated, but they didn't have the money, unlike us. So he raised almost $100,000 with just sitting at a table, which just shows you how far your passion can go if you're really dedicated to something. So 4 years later, the Hernando Skate Park opened up and was named Pigeon Park in memory of him. In 2018, Society opened up, and Society is an indoor skate park found in the Binghamton area near the Broad Arcs district and not too far away from Overton Park in Midtown. So my friend Mark Horrocks opened that up on a whim of a Facebook post that a skate park in Atlanta was closing down, and I posted the ramps are basically going for pennies on the dollar, and I was like, does anyone want these ramps? And he bought them, and he opened up a skate park. So this is a picture of myself and my son Doran that we were doing a photo shoot for the Wall Street Journal article that came out back in 2019. So here's another picture of the skate park. Even if you don't skate, it's worth visiting. They have amazing artwork all over the walls. They've got a really nice coffee bar inside, so you can just sit there and watch the skateboarding from above in one of the rooms. They actually have a room upstairs where you can drink your coffee and watch the skateboarding. Probably what I like most about what Mark's done over at Society is what he's done with the kids over there. He's every single Saturday and every summer and fall, he has skate camps and skateboard classes. And he's had over 300 children go through his doors to learn how to skateboard. So it's provided a real safe space for kids to learn how to skateboard. Their parents can watch them above. So we've got a lot of kids that have gone through those doors. So that was in 2018. And then in 2020, Raleigh Springs Skate Park opened up. And I actually had nothing to do with this park. What had happened was back in 2010, 2011, we were in the media a lot for Toby. And what that media coverage did was catch the eye of one of the councilmen, Bill Morrison, saw what we were doing, and he decided to put a skate park into their plan in 2013. So that in their master plan, he included a skate park, which at the time I thought that's a nice gesture, but I really did not expect them to build a skate park, but they did. So 7 years later, Raleigh Springs Skate Park opened up, and that's almost $1 million park. So that was a gift from the city that I did not expect, but great. We're a city full of skate parks, which is more than I could ever imagine. So I'm grateful for that. And then just one slide on leadership. These are things that I've learned in becoming a leader, I guess, a reluctant leader. I've learned relationships first. And I love this quote by Tim Hodges, who is over at the UT Health Sciences Center. He's the founder of Transnetics Genotyping, and he also got the COVID PCR testing done. We are one of 10 sites in the US that were approved by the FDA to test for COVID. So he got the testing, the high throughput testing done like within 2 months. It's amazing. But he built Transnetics, which is one of the largest operations for genotyping in the world. But his quote is, irrespective of our chosen professions, we are all in the relationship and people building business. And so he's basically saying, beyond the products that we make, beyond the projects that we work on, it's how we treat people, how we treat each other, and that everything will basically fall into place if relationships are placed first. And I found that in my work with the volunteers. You know, I wasn't paying anyone to help me run those skateboarding competitions or to come to different city meetings that we went to. It was just a matter of, you know, treating them decently. And I feel that when you do that, everything else takes care of itself. It's not something I learned probably in my 20s and 30s, where my career and getting through grad school were my main focus. But I've come to realize it makes everything else. It makes the wheel turn in life and also in your career. Just listening to people, I feel like listening is a lost art. Just ask questions. Ask your employees what they think. What's their opinion? What can their contribution be to the project? And if you do that, you just get so much more out of people. And if people feel listened to, their level of motivation goes up, because it's like they feel like they belong. They feel like that people are aware of them. So yeah, that's been a big one for me too. In terms of innovation, just creating a safe place for people to fail. You know, you create a transparent environment where people, you know, can tell you how they're feeling or what they're going through. You know, if you know, they're not afraid. If they're going through a tough time in their life and they're not motivated, it's not, why aren't you doing enough work? It's like, let's work through this and see if we can, you know, get you back on track, you know, or, you know, innovation occurs through failure. We all know that you always are going back to the drawing board. And if that's something that people are comfortable doing, you're going to get a better product and a better work culture. Leaders serve their employees and colleagues. I think that just goes back to number one, that those two are kind of tied together. But And I'd like to make a point that, leaders are not necessarily managers. You don't have to be a manager to be a leader. In fact, I would say that, yeah, sometimes if you're fortunate, you get a manager that's a leader, but a lot of times you don't. So each of us can be leaders in our respective areas where we work. Number 5, avoid or try not to be preoccupied with being recognized. I think I got a lot of press working on the skate park, but the last thing I was looking for was for someone to say, good job, Aaron, or, it just came along for the ride. And so focus on what you're trying to do, find satisfaction in accomplishing that goal, and recognition may or may not show up, and that's okay. It's not going to make or break your life. It's not your key to satisfaction. And then last but not least, courage, willingness to stand up for what is right. I had a time when one of the council people questioned why they were putting the skate park, why the city had plans to put a skate park in her district. And she rightfully was questioning it. But I questioned why she was questioning it. It's like, why not? And so that whole process went through the media, and it was kind of a mess for a while, but it was important, to see that there's, I think it gave permission for other people to stand up and not just accept what's pushed towards them. So, and I ended up becoming friends with this council lady. So, not only the courage to stand up, but also the courage to reach out and try to form bridges with people that you may not necessarily, hang out with when you're off work. And of course, a special thanks to everyone here, to the Telugu Association, for listening to me talk for an hour. It's been a real privilege to be here today, guys. Thank you. And if you have any questions for me, please feel free. This would be a great time to ask.
Okay, Aaron, that was really great. So you inspired us to do definitely 2 things, at least me. So probably it's too late for me to get a PhD in biological sciences, but I'll definitely go skating, which I haven't done any time in my life.
Great.
Okay. So thanks for that. So now we had a bunch of questions when we advertised about this. Many people sent their questions. Obviously, we don't have time to go through all of them, but we kind of skimmed through some of the questions, and we have a set of them here. So the first question is, what inspires you to do cutting-edge science at St. Jude's? Like, where do you draw your motivation from?
I think, before the pandemic, Danny Thomas, the founder of St. Jude, had the cafeteria set up in such an arrangement that we would see the children and the patients and the workers all ate together. So, seeing those kids, just more than anything, not only inspired me, but reminded me of what a privilege it is to be working on, the different products that we manufacture at the GMP. I would say that's my main inspiration. I don't know how that ties to cutting edge more than it does just day-to-day work, being reminded why I come to work.
So yeah, as you can see here, I mean, you need to start small here and improve incrementally, because many of us think that, okay, there is one day where we'll do a lot of work and then we can, just relax for the rest of the time. But as you can see, I mean, Aaron is saying we have to start small and build on it continuously to, really make an impact.
Yeah.
Right. Okay, the second question that we had, this one is an interesting one. So surfing and skateboarding, they're different. So at what age did you develop this interest in skateboarding? Was it after you came to Memphis, or were you doing it throughout your life?
I didn't really grow up skateboarding because I grew up in Newport Beach in Orange County. And so skateboarding was part of the surfing culture, but it was an afterthought kind of. So mostly surfing in my teens and 20s, and then it wasn't until we moved to Menlo Park and where I did my postdoc at Stanford that I started doing skateboarding. They built a brand new skate park across from our apartments there, and I was surfing then too as well on the weekends. But going surfing was 30 minutes to the beach versus walk across the street.
Wow. Okay.
So there's quite a bit of overlap between the sports. And so I kind of used skateboarding initially as a way of cross training. And then it became my main occupation there. So I was about 35 when I started really skateboarding.
Wow, that is, I mean, I'm 35 now, so I should probably start right now.
Absolutely.
Right? Absolutely, yeah. Okay, so we'll switch back and forth between the questions related to your work and surfing and skateboarding.
Sure.
So the other question that people were really interested was, I mean, people want to stay in Memphis, even though they get a degree in biological sciences. So they're asking, what are your predictions for growth in biotech in and around St. Jude? Where do you see St. Jude in the next 5 to 10 years, maybe?
Within our GMP facility, we are transitioning much more intensely into manufacturing cell-based therapies versus when I first got there, it was mostly focused on manufacturing therapies that were involved making proteins like the AG14-18 antibody. But we're going much more into gene-based therapy products, like I mentioned, like the lentivirus and the adenovirus. And there's other therapies. I did not mention the CAR T cell therapy, which is another cell-based therapy for treating cancer, but that's where I see the growth within our GMP. In terms of growth outside of St. Jude, there is Cognate Biosciences, which was just recently taken over by Charles Rivers Biotech, which is up in Massachusetts. Maybe they are looking into further investment in the.
And what about the other, hospitals? We have the Lovenor Children's Hospital, and we have, in general, the medical district around here, right? So do you see any opportunities for biotech growth in biotech in and around there?
I don't know directly. I don't think so much for the hospitals as much as maybe through Bioworks.
Okay.
Memphis Bioworks. Steve Bears is the CEO there, and they are an incubator for biotech related startups. So he's been working there for, I think he's been working on at Bioworks for 14 or 15 years. So maybe through there's been, I think, 3 or 4 at least startups that have gone through their incubator process.
Yeah.
But yeah, it's slow right now. Slow growth, just because historically we're not a biotech centric area. We are a medically oriented area, but that doesn't always lend itself to overlap with biotech.
Okay,
So,
yeah, that's good to know, definitely. Yeah. Okay, so now, in general, how do you stay focused and motivated to reach your goals, whether it's in your professional life or personal life? We want to know your perspective. Each of us has our own way of reaching our goals, but what has been your thing to stay motivated and reach your goals?
At least in the GMP, for me, it's been the opportunity to switch departments every couple of years. I did manufacturing for 4.5 years when I first got there, and then migrated over to quality control for 1.5 years, and now I've been in the analytical methods development group for almost 7 years. So I think for me, growth, just continued the opportunity to grow and learn new techniques. For me, I think, you have different phases of life. So what motivates you changes according to that phase of life. To me, I'm more interested in working with people now. So, we're working, I'm on a task force to help improve our workforce culture. So I find motivation there, but that's far different than the motivation that I had 10 years ago working in the lab. So just understanding that going with your phases of life and understanding your motivations will change is important, because otherwise you might get into burnout, not recognizing that something about you changed.
Burnout all the time.
Yep.
Okay.
So yeah.
Okay. So another related to work, what is the most important thing that you think makes difference in the lives of St. Jude's kids? I mean, you talked a lot about the therapies and drugs that you're developing, vaccines, and also, what do you think makes the most difference in terms of the kids who come there? What's been your take on this? You might not have worked directly, but
I think we just have an environment of hope. When families come to St. Jude, I've heard families talk about how they just felt hopeful. And like for each of us, we always need something to look forward to. But when they go to St. Jude, it's like they can look forward to possibly having their kid healed from their cancer or for whatever it is. So yeah, that instilling a sense of an environment of hope is really big at St. Jude.
So
and you can feel that.
Yeah, as you can see, I mean, you need to have that empathy to, understand what the other person is going through. Yes, the technical knowledge and professional success, all these are important, but they're not enough. I mean, the next level is you have to be empathetic to somebody's fears and somebody's, pain, so that you can actually, understand and provide them the required service, right?
So relationship building.
Your relationship, yeah, that's what you're talking about so far, right?
Absolutely.
Okay, so we talked about gene therapy, right? And you said 10 years ago, probably this wasn't something anybody has heard about, but now we're going big on this. So this gene editing and gene therapy, do you think it's going to cure all the diseases, or where do you see this going in the future?
Well, that's a far-reaching question. No, I don't. I mean, I would like to think that, but realistically, there's just cancer has an ugly face, and it has many ugly faces. It's not just one. So there's so many different forms of cancer. So we're working towards that. But 10 years, like it's not even 10 years ago. 5 years ago, if you would have told me that we could go in and edit DNA in vivo or within a person, I would say no. So my answer probably is not accurate based on.
Okay.
But who knows? Maybe. Yes, I like to think.
Yeah, we would all like to think, right?
Yeah, I'd like to think.
We want that magic cure for everything.
We do. But cancer is a complex. It's a set of complex diseases.
Yeah, that's
so
okay.
It's like I don't know. You've heard of whack-a-mole, where there's the game where you try to get the mole. You hit one mole and another one comes up. So it can be frustrating at times.
Okay. Okay. I think we're getting too much serious about these discussions. So let us have a fun question now. So what do you love the most about skateboarding?
Oh, what do I love about skateboarding? I think just the challenge of, and the challenge of trying a new trick, and then it used to be working with the kids, teaching them to skate was a big one. For me now, just being able to have a time to go out and think and have a distraction from work. I'm getting older, so it's getting more challenging to do. But I guess you just kind of get in this rhythm, and you lose yourself in activity. I think a lot of people do that, and so just having a nice, positive, healthy distraction.
Yeah.
I still have my son and I skate. I like skateboarding with my son. That's a big one too. He's 15, and we have a half pipe in our backyard. So being with him and skating with him.
Yeah, that's great. Yeah. That's great. No, okay. Okay, so the next question is, so what was your biggest motivation to build this skateboarding park? You talked about it briefly, but can you talk a little bit about the motivations the thinking that went behind all of this?
I think the fact that I was just starting to get so involved with it back in California. I was 36 when we moved here, so I'd only been doing it for a year. So it's like going cold turkey. Like, it's hard to quit something when you've really just gotten in the middle of it. So I just felt a very strong drive to continue on doing what I did back in California. So yeah, I'd say that's the main motivation, just to make available what I had accustomed to doing, and bringing a lot of people alongside me to do that had that same common interest. I think that was the big surprise for me, is like, there were a lot of people that I came to know that made me realize, okay, this is a common goal that we can all get around, not just my own personal interest. So that was the fun part too.
Okay.
Working with a lot of different people.
Okay, so far I had like short answer type questions. Now I have a true or false type of question, which is, skateboarding is not going to solve all the problems. Agree or disagree?
Agree.
Agree? Okay, why?
Okay. It's an absolute. I'll never.
It's just a trap.
I will seldom agree with an absolute.
Yeah.
Or disagree. I would almost said never, but no.
Okay.
Yeah.
Great.
Definitely.
Okay, great. Okay, so let us end this conversation with one final question. So, what advice do you give to people who are in their high school when they're thinking about their education and careers in general? What advice would you give them?
Look around your community, look around your city, your world, and find a problem that inspires you, you know, or an issue that you want to help be a part of to solve, and let that be your guide, you know. When I was a kid, I didn't think I'd ever end up in this field, but I wanted to solve cancer, wanted to cure cancer. And here I am many years later, maybe not directly doing the research, but I'm definitely involved in that. So, you know, find something that you really can feel like you can make a difference in.
Yeah.
That doesn't mean day to day you feel that.
Yeah.
Definitely not. There's lots of work and a lot of drudgery and routine tasks that we all have to do in our job. But when we look up from 30,000 feet, we can at least say, well, I'm part of something much bigger than what I do every day. And that inspires you.
Yeah, definitely. I mean, you need that motivation to keep going, right? I mean,
Yeah.
independent of, I mean, we all face hurdles in life, and you know, you never know what is going to come, but you have to have the drive to, you know, wake up every morning and, okay, today I'm going to do something different, or I'm going to improve by 1% maybe. Today, right? And that's what
Absolutely.
keeps you moving throughout your life. Okay.
Absolutely.
Okay. So that was a great conversation, Aaron. Thanks a lot for
Thanks,
your
Shafer.
time and inspiring our crowd. So we look forward to having you again sometime.
That'd be great.
Right. Okay. So that is all from our side. Okay. So now, Srinigaru, you might want to take over on this front.
Thank you very much. Can you hear me?
Yes, sir.
Oh, thank you. Thank you, Dr. Shafer and Dr. Murali and Dr. Sickle. This is a great inspirational speech. Dr. Shafer, really appreciate it. And you're not only well-educated and well-rounded, all-rounded, and your involvement in community, and you're the backbone behind the scene in building these skating arenas, skating rinks, and that's a great thing. And your whatever you mentioned about your leadership things, how your lifestyle, your life is inspirational, and it started with this as a scientist, and not just keep your life to the books and research, and you're involved in the social activities that is going to inspire a lot more kids. I hope our kids pick up something from here, and they spare some time, not just education and books, and they spend some time outside, get out and show them their leadership qualities and involve in the community. This is truly inspirational. And as I said, this is our first speech. I'm glad you came up and filled that. And this is the thank you so much for taking that initiative and helping us. And with that said, to all the Telugu community, please stay tuned. We're going to bring inspiring speakers and true leaders like Dr. Shafer, and people who are involved in the academics and community level and corporate level, and in personally and socially, whoever contributed their time to the community. With that said,